My name is Stanley Skarli, Pediatric Neurosurgery, Prisma Health. Pediatric neurosurgery involves the care of everything from the premature infant to those that go up to age 21, or those that are older that have conditions that are congenital in nature. It involves the care of conditions like hydrocephalus, and that's water on the brain, as well as for the conditions like spina bifida. And then we're involved in the conditions that involve head shape, such as very minor things like plagiocephaly, or the benign positional molding that we see very frequently, or craniosynostosis. And craniosynostosis is the premature fusion of the sutures of the brain, and that's something that we actually do almost exclusively endoscopically now, whereas previously that used to be done all with open surgery. We also do the children who have pediatric brain tumors, both benign and malignant. We take care of children that have spinal cord tumors and spinal cord injuries. We take care of children that have spinal injuries and the injuries that are related to other parts of the nervous system. Initially, I knew that I was going to be a surgeon because I've always worked with my hands ever since I was a kid. I've always fixed things. And so when I went into medical school, I was always a good diagnostician. I already knew how to diagnose things. And so when I went into medical school, all I did was change the data set. If you know how something works, then you can figure out what's wrong with it because you know how it works. Well, one of the things when you deal with pediatrics is that you really have two different patient populations. You know, when you're dealing with the really young kids, you're not educating the patient at all. You're really educating the parents. And sometimes there's challenges with that, and sometimes you are dealing with surrogate parents. And then there comes those transition years when you have the kids in their tweens, where you want to be able to talk to them and sort of involve them in their care so they don't feel like there's all this stuff happening to them and around them. And then as the kids get older into their teenage years, then you really have to give them some more room, and they have to also take more ownership of their own problem, particularly if it's something that's a chronic condition like hydrocephalus, because that's not something that's going to go away. They're going to have to be able to manage this on their own. I find myself sometimes, when you see some parents that come in, I remember a couple of times when you've seen this mom who you know has 6 kids, and they're complicated kids, and you know that at least one of them should not have survived through infancy. And yet you see this kid not only surviving, but thriving. And there have been quite a few times when I've told these moms, you know, the only reason why this kid is here like this is because of you. And so every chance I get when you see those cases when, you know, in most situations I would just be overwhelmed myself. I mean, and a lot of people say, you know, I could never do what you do. Well, okay. When I look at what some of these moms do, I could never do what they do. And so I always make sure that they know that I know why this kid is doing as well as they are. I tell families that I have 2 rules in my office. The first rule is, I'm here to protect your kid. And the second one is, knowing everything that I know, if this were my kid, would I let you do this to my kid? If it doesn't pass those 2 rules, then it's not going to happen. And so sometimes we watch a little longer and kind of follow things along. But if it comes to that situation where You know, if he were my kid, I'm going to tell you that if he were mine, that's what I would do. I'm going to push for you to do something because that's what I would do for mine. To make an appointment with me, please ask your primary care provider to make a referral.